Welcome to Integrity Linguistics Institute. Now let's read this audio script. Okay, let's listen to the audio script.
Hi, my name's Anna Matthews. I'm an occupational therapist working here in the hospital. In a moment, I'm going to present a case study to you to show you the type of work I do. But first, let's think about what we understand by occupational therapy and the part it plays in patients' recovery. In simple terms, therapists like me help patients of all ages to participate in the things they want or need to do through the therapeutic use of a range of recognized activities. For example, this could be helping patients who are recovering from illness or injury to regain skills and get back to work. Or it could be supporting older adults who are going through physical and cognitive changes. What I always have to keep in mind, however, is what the individual wants to achieve. I always say that a doctor's first question is, what's the matter with you? Whereas my first question is, what matters to you?
Okay, so let's understand. All right. So let's take a look into the 37 question now. All right. So let's have a detailed discussion regarding this. Those who have doubts, you can always feel free to clarify your doubts towards the end of the session. So let's go quite quickly because I think most of you actually got the answer correct. So comprehension, retention, and then comes detection, right? Step number one, to comprehend the question. That is, you have to do the keyword analysis and understand the question, understand what type of question this is. Okay. And then, mentally prepare yourself to bring in the right strategies. And then you have to register the information to your memory. Okay. The question should be registered into your mind. That is the proper memory you should have. And then with that memory, with that focus, you should listen to the audio and choose the correct answer option by eliminating the incorrect answer options. So what I would always recommend is when you're practicing listening or practicing reading, yes, finding the correct answers is very important. But at the same time, you put a little bit more effort into understanding why the wrong answers are wrong. That is why you are eliminating the incorrect answer options, because elimination strategy is extremely important as well. Right. So let's understand the stem of the question, the question stem. So here, the occupational therapist, that is Anna, says that the main focus of her work as an occupational therapist is, okay. So answer option A, answer option B, and answer option C. What are all these answer options? They are all very simple. Everything is main focus. Okay, regarding her work, the focus. So that what's the synonym for the main focus over here? We can say the main objective, right? Or we can say the main goal, okay, or the main aim, okay, the main target. Okay, so these are basically some synonyms for the word main focus. So what is the main objective, the main goal, the main aim, or we can say even the main ambition? Okay, that is the ambition of the work that she is doing. Okay, so this is what you need to focus on. So as I told you, when you are listening to main idea or main focus type questions, that person will be highlighting certain information. That person will be repeating some information multiple times. Okay, a little bit more stress will be given to one of these answer options. Okay, the other two will not be given too much importance. It may be just vaguely mentioned only. Right. Now let's take a look into the keywords over here. So let's see what is answer option A telling. Designing activities to meet the changing needs of each patient. So the main focus of a work is to design activities. What is the meaning of design activities? Design basically means to think. Okay, to create. Design basically means to create activity. So her duty over here is to think, to contemplate, to research, and to create activities. And why is she doing this? To basically means to meet a purpose. Okay, why? So why is she doing it? To meet the changing needs of each patient. Okay, so changing needs basically means what? On day one, the patient will have certain needs, but after 10 days, the patient's needs will be different. So imagine that there is a bedridden patient. Okay, so bedridden patient, the first 1 or 2 days, they will have very critical needs. But after 2 or 3 weeks, they will have different kinds of needs. Right. So here the main focus of our work is to design activities. It's every single day. Okay, for one single patient, every single day she has to, design and create activities to meet the changing needs. Right. That is the needs of the patient keep on changing. Now, what is answer option B telling? B is telling making sure. Okay, the main focus is making sure she supports patients in reaching their goals. Okay, so what is the main goal of her work? Okay, she's working as an occupational therapist. So the main objective of her work is to support the patients, okay, to reach their goal. So every patient will have a goal. Every single patient who's admitted in the hospital, what is their goal? Their goal is to get out of the hospital, right? They just want to get discharged. They want to, so for example, someone is having a fracture, arm fracture. What is their goal? Their goal is to use their hands once again and play basketball. Right. So whatever their goals are, okay, the main focus of our work is to basically what? Support the patients in reaching that goal. Answer option C, being flexible enough to deal with patients of all ages. So over here, what is the main focus? Being flexible. Now you see over here, what is the meaning of flexible? That is the opposite of being rigid. Okay. Because see, this is a advanced word over here. Rigid basically means what? Rigid means very strict, or it is just, one-sided. One-sided, that is, it's just one particular method. But what's the meaning of flexible? Flexible basically means, you are highly adaptable. Okay, so what's the another word for flexible over here? Adaptable. Right. See, for example, if you take a water and if you put water into a jug, it forms the shape of the jug. If you pour water into a glass, the water forms the shape of the glass. But what about ice cubes? If ice cubes you put into a jug, will it completely adapt to the jug or the glass? No, right? There will be some there will be some gaps in between it. So this is the meaning of flexible. Flexible basically means they are easily adapting. Okay, so easily adapting to deal with patients of all ages. So young patients require a different way of dealing. So when you're dealing with young patients, the approach is different. When you're dealing with middle-aged people, their approach is different. When you're dealing with geriatric patients, their approach is different. So here, her main focus over here is to be as flexible as possible when dealing with different age groups. Right. So like this, again, there is, so these are all like a little bit lengthy answer options, but don't worry, there is a small trick over here, and that is what we call as the verb analysis, right? So here, what I'm going to give you regarding the verb analysis is to identify the action words. Okay, the action words in the answer options, that are the verbs over here. This will help you to save time. Okay, to save time, and it will also enhance your clarity. Right? It will help you to save time and also enhance your clarity over here. So let's see what are the action words in answer option A. What are the action words over here? What are the verbs over here? Designing. Now you see, designing is an action, right? Okay? Designing activities to meet the changing needs of the patient. So we can say this is the main focus. Now you see over here what just happened. A very lengthy answer option has become now very tiny over here. The main focus of our work is to design activities. Okay, that is the ultimate goal of our work, to design activities. For again, this you should have a memory, changing needs of the patient. That is a keyword and that you have to adjust it. But the main action over here, the main verb over here is to design activities. Now, what is the action word or what is the verb in answer option B? Making sure she supports patients, right? That is, what is the main focus of her work? Her main focus over here is to supporting her patients to reach their goals. Again, that is a bonus thing that again keeps your mind, but this is the main thing, okay? Supporting the patients. What is the action in answer option C? What's the verb in answer option C? Being flexible enough to deal with patients of all ages. So we can say flexible dealing is an action over here, and flexible also. So we can say being flexible. Okay. How about, so here there are basically, two verbs over here. Flexible is one verb, dealing is a verb. If you want, you can do the entire thing, flexible enough to deal, or you can say being flexible. Okay, so there are two verbs over here, but I would say this is the main verb. Okay, the main action over here is to be flexible. That is when they're dealing with patients of different age groups, to be flexible. That is, they're highly hardy, adaptable. Okay, they are not using just one single approach. Every single patient, they are adapting to the patient. Okay, that is, they are matching the energy of the patient depending upon the age group. Now you see over here, that is the main focus of our work. Right. Now you have little bit more clarity. Now see, very long lengthy answers became very, very short and tiny. So what's the main focus of our work? This is again, I'm trying to give you some idea on how to save time and enhance your clarity. So give importance to the verbs over here. Okay, so the duty is to, the main focus of of this particular occupational therapist is to design activities, support patients, and to be flexible when dealing with patients. Now, you see, this is a little bit more easier to keep in your mind, right? Now comes retention. Now, what do you need to do? Now, what you need to do is, when you are about to listen to the audio, your eyesight should only be in the answer option. That is, do not read the question. That is, do not read the question when you're supposed to listen to the audio, because sometimes in the very first sentence itself, they may, directly come with the answer options. That information will be there. So if you are going to distract yourself, again, the OET is trying to distract you. So you don't distract yourself by reading the question. Right. If it's a tough question, again, as I told you, sometimes it may be a very difficult question. So you may have no other option but to read the question. But you have to train yourself such that you register the memory of the question very much thorough over here, and you take a look into the answer options when you're listening to it. So here, the main focus of her work's main objective. Okay, designing activities, supporting patients, and being flexible. So this should be in your memory. And when you're listening to the audio, you have to listen very attentively and eliminate the incorrect answer options one by one. Right. So this is the strategies that we can implement. So we listen to the audio 2 times. So now let's take a look into the audio script over here. Right. So let's see what this occupational therapist, that is Anna, is doing over here. So Anna is saying, "Hi, my name is Anna Matthews. I'm an occupational therapist working here in the hospital. In the moment, I'm going to present a case study, okay, to you to show the type of work I do. But first, let's just think about what we understand by occupational therapy and the part it plays in patient's recovery. Now, see over here, this is just an introduction, right? She is just introducing herself. My name is Anna Matthews. So when you're listening to it, okay, I don't care what your introduction is. My duty, the only thing I care is, what is your work and why do you do that work? What is the main objective of your work? That is the only thing I want to know. I don't want to know what your name is. I don't want to know, like, in which hospital you're working and all that. Okay. So that you should be able to discriminate, that ability to discriminate which information is essential and which information is non-essential. That is a very important skill that you need to develop. So here the person is saying, I'm going to present a case study. Okay, good. Present a case study to show you the type of work I do. Okay, you're going to tell me the type of work I do. But first, let's think about what we understand by occupational therapy and what it plays in patient's recovery. So now she's going to introduce, she's going to explain to us what is occupational therapy. Right. So that is what she's saying over here. So in simple terms, okay, so in very simple terms, she's explaining what is occupational therapy. Now, what is your duty here? So is your duty to find out what is occupational therapy? Okay, is this why you're listening to the audio, or are you listening to the audio? Why? What is the, or we can say, what is the main focus of occupational therapy? So among these two, what is occupational therapy, or what is the main focus of, why are you listening to the audio? You're listening to the audio to listen, to find the answer to this question. Okay, so here the person is saying, my name is Anna Matthews. I am an occupational therapist. I'm working in this hospital, and I'm going to explain to you, I'm going to help you understand what is occupational therapy. So your mind should tell you, okay, I'm just listening to what is occupational therapy. That is not what is important to me. My duty over here is to identify what is the main focus of occupational therapist. So you have to wait. You have to very patiently wait until that particular message comes. Right. So let's see what the person is saying. So here the person is saying, in simple terms, therapists like me help patients of all ages to participate in the things they want or need to do. Okay, through the therapeutic use of a range of recognized activities. So this is the definition of of the occupational therapist over here. Right. Now you see there are certain keywords over here. Okay. So what are the keywords? The first keyword that is repeating from the answer option is all ages, right? Occupational therapy, like me, help patients of all ages participate in the things they want or need to do. So as soon as you hear the all ages part, you should go to answer option C. Now your eyesight over here, right? Now your eyesight should be in answer option C, because what is there in answer option C? In answer option C, you can see this particular word, that is all ages, patients of all ages. And this exact word, this exact keyword, this phrase is being mentioned in the audio. So your eyesight. So remember when I told you, when you're listening to the audio, your eyesight is all in the answer options. So your eyesight should come over here. Okay. Now what is the verb over here? The verb over here is being flexible. Okay, and main focus. So now your eyesight, again I'm giving you the strategies, right? So now your eyesight is an answer option C, because they told about patients of all ages, right? So this is mentioned. Okay, this keyword is mentioned, right? But here the action word, what is the action word over here? It is being flexible. Okay, so that is not yet mentioned. So you have to wait very patiently whether they're going to say this. That is my main focus over here. So what is your duty over here? Your duty over here is to identify what is the main focus of a work. So you have to wait whether the person is going to say my main focus over here is to be flexible with patients of all ages. So only this is mentioned. Okay, this particular thing is mentioned, but until now, okay, until now being flexible is not mentioned, and that is the main focus. These two words are not yet mentioned, right? So only if this two is mentioned in connected to this, you can choose answer option C. But until then, your eyesight is in answer option C. Okay, so this is how your brain should work, right? This is how you have to train yourself when you're dealing with part C questions. So let's come back to the audio script over here. So here the person is saying, for example, now see, they are giving an example. So remember when I told you in in a movie, if there is a main hero or a heroine, okay, they will have a lot. So for example, when you're watching a song and all, the main heroine will be in the middle of the song, and to support them, there will be a lot of background dancers, right? The background dancers, what is their purpose over there? The purpose over there is to highlight the heroine. Right. So similarly, in main focus type questions, you will be listening certain examples. Right. So the examples are not what the answer is. The example is to just highlight the main focus. Right. So do not get distracted by examples over here. So for example, this could be helping patients who are recovering from illness or injury to regain skills and get back to work. Or it could be supporting older adults who are going through physical and cognitive changes. Right. So here we can say it is little bit, okay, it is little bit related to, answer option B, right? Now say, what is the keyword over here? The keyword over here is supporting the patients, making sure she supports patients in reaching the goals of the patients, right? The patients have certain goals, and the main focus of our work is to basically support patients reach their goals. So we can see that some resemblance is there to answer option B. So from answer option C, okay, now your eyesight should go to answer option B, right? Because that is the things that is mentioned, supporting patients to reaching their goals. Now see over here, for example, this could be helping patients. So what is the synonym for helping patients? Helping patients is nothing but supporting patients, right? Helping patients, supporting patients who are recovering from illness or injury to regain skills and get back to work. Okay, again, regain skills and get back to work. What is that? That is a goal, right? The patient's goal over here, the goal of the patient is to get back to work. Okay, now you see over here, the example is giving some importance to the keywords of the answer option B. So your eyesight, okay, your eyesight is now in answer option B over here, right? So now let's keep listening to the audio script, or it could be supporting older adults who are going through physical and cognitive changes. Now you see over here, now the word supporting is also mentioned. Now look very, very carefully over here. Okay, so this is an example. Okay, so in this example, they're talking about supporting patients, they're talking about helping patients, and they're also talking about the goals of the patients. Right. So everything, okay, everything related to answer option B is mentioned. Now, what is answer option B telling? Answer option B is telling, making sure she supports patients in reaching their goals, right? So we can say that this keyword is mentioned, but this keyword is mentioned. But can we choose answer option B because we have listened to every single thing? No, we cannot choose answer option B yet, because what is the question asking you? The question is asking you the main focus of our work. So you have to wait very patiently for the person to confirm this message. That is the main focus. The main goal of our work is to support patients to reach their goals. So this is just mentioned only. Supporting patients, reaching their goals, that is mentioned, but the speaker has not yet revealed that this is the main focus. So we cannot choose answer option B yet. But your eyesight is now in answer option B, and you suspect, okay, you have a suspicion that B could be the correct answer. Right. So now let's once again listen to the audio script. Again, this is how your brain should work in the examination day. Now the person is saying, what I always have to keep in mind. Now see, always. Always is a very strong word, right? Always have to keep in mind is, however, is what the individual wants to achieve. So here, what is the speaker saying? Every single second, every single time that I'm spending to that I'm treating a patient, my mind is focused on what the individual wants to achieve. So what is the synonym for the word goal over here? Okay, goals, achievement. Don't you think they are synonyms? Okay, achievement of a person, you want to achieve something, you want to achieve a goal, these are all synonyms over here. So what is the person saying over here? The person is saying, again, always is a very strong word, right? So the repeating, now you see the repetition is coming, helping patients, supporting patients, okay, reaching their goals over here. And now you see once again the repetition is coming. What I always have to keep in mind is what the individual wants to achieve. So they're talking about achievement, they're talking about goals over here. Now see the emphasis, you see the repetition over here. Now see once again the word always is coming. Okay, now here the person is saying, I always say that a doctor's first question is, what's the matter with you? So what is the speaker telling? The speaker is telling, okay, so before that, let me just zoom into this particular thing over here. Now you see over here, why is this particular information written in quotations? Now see, what is the matter with you? Every other word is not written in quotations, but you see over here, here they have written in quotations, and here they have written quotations. That is this inverted comma. So why do we use inverted commas? We use inverted commas when we are saying another person's dialogue. Okay, when we are saying another person's dialogue or another person's statement, we use inverted commas. So over here, the doctor's first question. So here, this person is not a doctor. This person is an occupational therapist. So the person is saying, usually what do doctors do? When a patient goes to a doctor, the doctor will ask them, what is the matter with you? Right. So imagine that a patient is going to a doctor, the doctor will first ask the question, okay, what is wrong with you? What is the matter with you? What is your problem? Right. Whereas is a contrast marker. Okay, it is a contrast marker which we discussed in yesterday's class. Whereas my first question, that is the occupation therapist question, is what matters to you? Okay, what matters to you basically means that is a it is a phrase. What matters to you means what is important to you, what is the most important matter to you. So when a patient is going to an occupational therapist, the occupational therapist will first ask the question, what is your goal? What do you want to achieve? What is the most important matter to you? That is the first question that an occupational therapist will ask. So what do you think? So from this, again, this is not a direct question, this is an indirect question, because you have to identify the main focus of the question over here. So here we get the idea. Okay, we get the idea, that is, we get the repetition that the person is saying, okay, to help patients, okay, to support patients, to to regain the skills, and also to achieve the back to get back to work. That is a goal over here, right? And also this is I always, like what the individual wants to achieve, achievements, goals. Okay, and here also now you see the repetition, what matters to you. Now see, because it is a main focus, because this is a main focus type question, a main idea type question, the speaker will always tend to emphasize and always repeat one particular information. Now you see the repetition that is happening over here. So this, what is being repeated over here? Answer option B is being repeated, right? That is making sure she supports patients in reaching their goals. So what is the action word over here? What is the verb over here? Supporting the patients, right? So this is what we were waiting for. So in the example, we listened to the audio. That is, they mentioned the keywords, right? But we were waiting to confirm whether this is the main focus. So here, yes, the confirmation has been received. The confirmation is that whenever she asks, when she sees a patient, the first question she asks the patient is, what is the most important thing to you? What is your goal over there? So that is the entire focus of our work. So we can say without any doubt that answer option B is indeed the correct answer, because the verb is mentioned and also the keyword is mentioned. Everything is mentioned over here, and also we can make the connection. Okay, the connection is directly done over there. But let's say that you find it difficult. Let's say, see, it is not very easy for you to think very clearly and choose answer option B over here. So that is why you have to bring in your best friend in multiple choice questions, and that is the elimination strategy. Which means if you are unable to choose the correct answer, again, easy questions you can easily work out, but if it's a tough question, you cannot very clearly and choose the correct answer option. So here the best friend over here is the elimination strategy, right? So let's eliminate the incorrect answer options. Now see over here. First, we went to answer option C, right? Patients of all ages. This was mentioned. Okay. So this keyword was mentioned over there, but being flexible, this was the action word. This was the verb over there. Was this mentioned anywhere? That is, the main focus of our work is to be highly adaptable, was to be highly flexible to deal with young patients, old patients, middle-aged patients, and all that, pediatrics, geriatrics. Was that mentioned? That is being flexible. So this was mentioned, but being flexible, that was not mentioned. So since this wasn't mentioned, again, dealing with patients. Now see over here, dealing with patients. Okay, dealing with patients is mentioned, but being flexible enough to deal with, that was not mentioned. So we cannot choose answer option C. So C we can eliminate. Now what is C? Okay, C is partially correct. Okay, dealing with patients. So this part of the answer option is definitely mentioned. This is definitely mentioned, but this portion is not, the verb is not mentioned. Now what is answer option A telling? Designing activities to meet the changing needs of the patient. Did we read anything about designing activities? That is the main focus, is to create every single day, to create activities. Designing activities is the main stem of the answer option. That is not mentioned. Nothing. Okay, activities is not mentioned. Designing activities is not mentioned. And also the changing needs of the patient. Nothing else. Okay, so there is absolutely nothing mentioned about changing needs, designing activities. So you can eliminate answer option A. And answer option C also you eliminate. So even if you're confused, even if you don't know what is the correct answer, if you're able to eliminate at least one, so at least A you eliminate, then it is 50-50 chance. Then it is either B or either C. So if you're lucky, you will choose answer option B and you will get that correct. But at least one answer option you must be able to eliminate. Right. And you must be able to eliminate this one as well, because this is the action that is not mentioned. So if A and C you're able to eliminate, then the answer option, which is the most difficult to eliminate, is answer option B. So by default, whether you don't even know that B is the correct answer, A and C is eliminated. So this becomes the correct answer. So B becomes the right answer. right? So this is how your brain must work. So again, we have time. Okay, those are writing the exam very soon also. No worries. Again, I just want to remind that, the sample questions are a little bit challenging. Okay, again, as told in the yesterday's class as well. So the sample questions, be it listening, reading, writing, speaking, it is a little bit advanced. But on the examination day, it won't be, exactly as tough as this. Few advanced questions will be there, but it is still going to be manageable. So don't, become too perplexed, or don't scare yourself by expecting all questions to be of this difficulty level, right? So let's take a very small recap of the 37th question just once again, just to solidify. So this time, read the 37th question and listen to the audio, and you bring in the elimination strategy. You look for repetition. Okay, remember I told you this is a main focus type question. So you have to look for repetition. You have to look for emphasis. Okay, and bring in the elimination tricks as well, and make sure that you're eliminating A and C and choosing B. So let me just play the audio just one single time, and then we'll be dealing with the second question. Adapting to their needs. Now let's read this audio script. Okay, let's listen to the audio script.
Hi, my name's Anna Matthews. I'm an occupational therapist working here in the hospital. In a moment, I'm going to present a case study to you to show you the type of work I do. But first, let's think about what we understand by occupational therapy and the part it plays in patients' recovery. In simple terms, therapists like me help patients of all ages to participate in the things they want or need to do through the therapeutic use of a range of recognized activities. For example, this could be helping patients who are recovering from illness or injury to regain skills and get back to work. Or it could be supporting older adults who are going through physical and cognitive changes. What I always have to keep in mind, however, is what the individual wants to achieve. I always say that a doctor's first question is, what's the matter with you? Whereas my first question is, what matters to you?
Okay, so let's understand. So is it more clear this time? Okay, so that thoroughness is very important. And as you can see, the record lectures are available in the app. So those who want access, just let me know. I'll give you access to the app, because automatically the expiry happens. All the detailed lectures are available there. Right. So before we go to the 38th question, like, I just want to showcase just one small document over here that I have prepared, and I'll be sharing this document to you. So as you can see over here, I'll be sending this document. So this is a main focus type question. Right. So here you have to first of all identify the type of question. Okay. So main idea or a main focus type question. It is testing whether you can identify the central point or the main emphasis of the speaker's talk. So in such questions, the speaker's perspective, priority, or focus is what is important, not just surface level information, right? The main focus. So this is the thing that you need to identify. Okay, so I have given you certain tips over here to identify these type of questions. So you can basically take a look into it. And then once you have identified, okay, then you have to mentally prepare. Okay, that is a mental preparation that happens. And you have to bring in the right strategies as well. So when you see this type of question, first and foremost, calm your mind. Okay, so if you're having you may be the strongest candidate in the room. Okay, in the examination hall, you may be the most skilled candidate, the most brilliant candidate. But if your mind is not calm and clear, it is not going to help you out. Right. So again, perform under pressure. Always remember that in a high pressure situation, you must be able to stay calm. Otherwise, OET is going to be extremely challenging. So calm yourself mind, remind yourself what is the overall message. Okay, your duty is to find the overall message over here. Listen actively for emphasis, right? Because this is a main focus type question. So they'll be emphasizing and repeating certain words over there. Right. Think like the speaker, because in part C, we have a speaker and you have to think from the perspective of the speaker. That is what we call as empathizing skills. Right. So if I were Anna, what would I say is the heart of my work? So like that, you have to ask yourself the right questions and don't get trapped by examples. The OET is very cunning. They'll set a lot of traps for you. So don't fall for the examples. Understand that examples are just to support the main focus. Okay. But ultimately, you have to determine what is the main focus. Okay. And then you have to bring in your elimination of the incorrect answer options. Okay, so here I have discussed why answer option A is eliminated. This designing activities, that is not the main focus of our work. Answer option C also being flexible. Okay, that is also not mentioned. So that is not going to be the right answer. The correct answer option is B, making sure she supports the patients. Okay, so again, you'll be getting this document, and those who really struggle with vocabulary, those who struggle with synonyms, I have made a list of the different difficult vocabulary, their meaning and the synonyms as well. So you can go through this document and you will be able to get this. So here you need to have certain skills. First and foremost, you need to have the ability to listen for paraphrasing, that is synonym recognition. Now see what matters to you. So if you don't understand what is the meaning of this phrase, you're going to really struggle, right? So what matters to you basically means supporting the patient's goals. Okay, matter basically means goals. Okay, so like that, develop your vocabulary range and then refine your inference skills as well. Inference basically means coming to your own conclusion. Right. So you have to understand what's the implied meaning. It is not, see there, it is not going to be directly said. Okay. It is usually implied. So you have to use your sense. You have to sense it. Okay. So like this. So don't chase every single detail. Focus on the speaker's intention and repeated emphasis. That's usually where the correct answer is hidden. Right. So again, I have prepared this document towards the end of the session. I'll be sharing this document to you. Now let's listen to the audio script.
Now, onto my case study. It involves a patient called Ted, a 60-year-old man whose motorbike was in collision with a car. Luckily, the accident happened at moderate speed, but he still suffered compound fractures in both legs, in one arm, and several broken ribs. When I first met him, after 2 weeks in hospital, he was physically and emotionally broken. After all, not only was his mobility in question, but much more importantly, so was his style. Doctors had told him that he might never be able to squeeze into his motorbike leathers again. So he'd given up. Imagine how he must have felt. One day, totally independent, and the next, suddenly unable to do things anymore.
So what's the answer? All right, so this is a medium difficulty question or a slightly advanced question, we can say. So I'll play the audio once again. This is an attitude type question, right? So this is not a main focus type question. Here you have to identify the attitude of the person.
Now onto my case study. It involves a patient called Ted, a 60-year-old man whose motorbike was in collision with a car. Luckily, the accident happened at moderate speed, but he still suffered compound fractures in both legs, in one arm, and several broken ribs. When I first met him, after 2 weeks in hospital, he was physically and emotionally broken. After all, not only was his mobility in question, but much more importantly, so was his style. Doctors had told him that he might never be able to squeeze into his motorbike leathers again. So he'd given up. Imagine how he must have felt. One day, totally independent, and the next, suddenly unable to do things anymore.
It's a tricky question. Right. So step number 1, comprehension, right? So let's comprehend the question over here. Let's understand what is your duty. So when Anna first met the patient called Ted, she was. Now see over here, she is basically Anna. Okay, so Ted is a patient over here. The patient is Ted. The occupation therapist is Anna over here. Now, what is the question asking you to find out? When Anna first met the patient, that is the very first interaction with this particular patient, how was she? That is, how did she, what went through her mind? That is, she is occupational therapist. She's opening the room and she is meeting this particular patient for the very first time. As soon as she saw him and that first interaction, what went through her mind? Now, see over here, your duty over here is to identify the attitude. Okay, that is what was Anna's attitude when she first met the patient called her. That is what was the impression that got registered into her mind when she first met this patient. Right. So now you have to train yourself. Okay. Now, okay. that is the first interaction. How did she feel about that first interaction? That is the attitude. Now, what is the answer option A? Answer option A is unable to identify completely with his attitude. So here she is telling she was not at all. She was unable to identify. Identify basically means to connect. Okay, identify basically means to connect with the person. She was unable to identify completely with his attitude, which means the patient was in a very negative state of mind. Okay, the patient was in a very negative state of mind, and when she first met the patient, she was not able to, make a connection. She was not able to identify with his attitude. Means there was a misconnection over there. So she was not able to identify with the attitude of the patient called Ted. Answer option B, she was optimistic. Okay, optimistic that he would regain full mobility. Optimistic. What is the meaning of optimistic? Optimistic basically means positive, right? Positive. Okay, and what is the meaning of pessimistic? Pessimistic basically means negative. Similarly, skeptical. Okay, skeptical. All these are things are basically the meaning of negativity. Okay, so optimistic basically means positive, right? So when she immediately met the patient, now see over here, what is the attitude over here? So this is answer option A. Okay, so answer option A is a negative feeling, right? So this is a little bit of a negative emotion, right? The negative emotion, what is the negative emotion? That means she was unable to identify with his attitude. Means she was uncomfortable with the attitude of the patient. That is a negative emotion that is coming over here. But what is the emotion in answer option B? Optimistic that he would regain full mobility, which means it is a positive information. Okay, it's a positive emotion. That is, it is extremely positive, right? It is extremely positive, we can say. It is optimistic. Okay, extremely optimistic. Extremely positive information, optimistic that he would regain full mobility. Now see over here, let's just give you a small information regarding the tense usage. Will becomes would, right? Can becomes could. Okay, so you have to understand all these things. So you will pass the OET. You can pass the OET. What is the difference? You will pass the OET basically means it is 100% sure, right? You will pass the OET. Okay, so that is the meaning of will over here. So the future tense of will. Okay, is it really future tense? Like he would have been. Okay, it's not entirely future over here. Will is future tense. It is perfect future tense. So it is a past perfect tense, right? So here once again, so will becomes would, and that means it is 100% certain. So can over there. So you can pass the OET. You can positive means you have the potential to pass. You have the potential to pass, but it is not 100% certain. Now see the difference over here. So this is a very, very strong word. He would, that means he definitely will regain full mobility. That is, every problem that he has right now, it will completely go away and he will definitely become fully healed. And she was extremely optimistic, that is positive, optimistic about it. Now see, that is a very, very positive emotion that is coming. Right. Now, what is answer option C? Answer option C is telling she was mainly concerned about his state of mind. Okay. So the patient's state of mind so he is not in his mindset. Okay. So the patient is maybe a little bit depressed. Okay. The patient is a little bit frustrated. The patient is a little bit, not very, happy. Okay. So seeing his state of mind, she was concerned. Okay, so is concerned. So we can say the emotion over here. The emotion over here is a little bit of an empathy. Okay, it is she is empathizing with the patient. Okay, so it is empathy. It is a mixture. Okay, it is a mixture of both positive and negative. So the patient's mind. Okay, the patient's mind is negative. Okay, but the emotion she is feeling, so concern is a positive feeling, right? So she is concerned about his negative, so that is a positive information. That is a mixture. So we can say it is a empathizing, that is she is actually feeling an empathy for the patient. Right. So that is what we can say. Now, anyway, over here, let's take a look into the verb analysis. Okay. So that is what that is the most important thing. Okay. The action words over here. So here, she was, that is what was the attitude of this particular patient. Answer option A. So what is the, just give me a second. Yeah. So what is the action in answer option A? Unable to identify. Now see, this is the action over here. She was not able to identify with the attitude of the speaker. Okay, so we can say the attitude. So these are all keywords over there. So you have to register this. She was not able to identify with she was not able to, right, identify with the attitude of the speaker. Answer option B. What is the action over there? Optimistic that he would regain full mobility. Now see over here, he will regain. So this is the action over here, right? Regaining. That is, he will definitely. So she felt that she will definitely regain full mobility. And again, the keyword also should be in your mind. Okay, regaining full. That is the action over there. Now, what is the action in answer option C? Mainly concerned about the state of mind. So here it is concerned. Okay, so she was concerned about his state of mind. So you should be able to make the connection like this. Now you see, she was unable to identify with the attitude. She was certain that he would regain full mobility, and she was concerned. Concerned, regaining full mobility, and attitude of the patient, negative attitude of the patient. Again, this is a slightly tricky question. Okay, so this is what you have to identify. Okay, so it's a little bit challenging to comprehend this question as well. Now, anyway, you do your best. Okay, you with a calm mind, you read the question, you identify. Okay, this is an attitude. So the first interaction, how did she feel? Okay, so like this, you try to grasp all the important information to your mind, you comprehend the question, you retain the question, retention you do, and now you have to look only into the answer options, right? Only into the answer options you need to look, and you need to read the passage, and you need to determine what the correct answer is, right? So shall we do that? Right, so let me take the audio script quickly. All right, so now over here, again, the memory of the question, right? First interaction, how did the occupational therapist feel when she met Ted? Now, the person is saying, now on to my case study, the case of the patient. It involves a patient called Ted. So who is Ted? A 60-year-old man whose motorbike was in collision with a car. That is, it was a vehicle accident, a vehicular accident over here, motorbike. So his motorbike collided with a car. So it is an accident case. Now, luckily, the accident happened at moderate speed, but he still suffered compound fractures in both his legs, in one arm, and several broken ribs. Now, you see over here, this entire information, okay, this entire information along with this thing as well. This is fully what we can call as a distractor. It is not helping you in any way. See, what is your duty over here? Your duty over here is to identify how she felt when she first met him. Right? This is what we are waiting for. When she first met the patient, how did she feel? So, this entire information is of absolutely no significance to us. Okay, so you have to, again, this is what I told by bringing in the discrimination ability. You have to be able to discriminate which information is useful and which information is not useful. Right. So if you have clarity, the first interaction, how did the Anna feel? Okay. So that is what you're waiting for. So what happened to the patient, the name of the patient, the fractures of the patient, that all is not all important to us. The first interaction, that is what we were waiting for. So now from here onwards, you have to become alert because the question is coming. Right. So let's see what the person is saying. So from here onwards, you have to listen very attentively. So when I first met the patient after 2 weeks in the hospital, he was physically and emotionally broken. Now see over here, she is not telling her attitude. Okay, so you're here. What is your duty over here? Your duty over here is to identify how she was feeling, not how the patient was feeling, right? So how she was feeling, but here they are telling how the patient was. So they are telling the condition of the patient. When I first met the patient, he was physically broken and he was emotionally broken. Right. Now see, physically broken, emotionally broken. Now, where did we hear the word emotionally broken? in answer option C, right? Because what did we read in answer option C? The state of mind. Okay. So his state of mind, that means his mind is emotionally broken. That is so this is mentioned. When he first met the patient over there, the patient's mind, the state of mind is definitely mentioned over there. So this is mentioned. Now, what do you have to do? Now you have to wait for confirmation whether this is mentioned. That is the concern element. Okay, that is when she first met the patient, was she very much concerned regarding the emotional state of the patient? So this we have not yet listened. We are still waiting. Okay, so once you get the idea, yes, she was very much concerned about the emotional state of the patient, then you can choose answer option C. But right now we cannot choose answer option C. But where is your eyesight? Your eyesight is now in answer option C, right? Your eyesight should now only be in answer option C because this is where the keyword has been repeated. Right. So now your eyesight is in answer option C. You're waiting for confirmation whether she was concerned. After all, not only was his mobility in question, but much more importantly, so was his style over there. Now you see over here, what is the word over here? His mobility. Okay. His mobility in question. Okay. Question. That means his mobility is in question. So here, when she first met the patient, okay, she actually saw that the patient's ability to move, okay, mobility is doubtful. Okay, mobility in question basically means what? Mobility in question. Mobility in question basically means mobility is doubtful. Don't you agree? Okay, that is whether the patient will be able to move or not. It is highly doubtful whether the patient will be ever be able to move. The mobility is doubtful. That is the meaning of mobility in question. Now, where did we read about mobility? We read about mobility in answer option B, right? Now your eyesight. Okay, now your eyesight should be in answer option B, right? But what is the action word over there? Optimistic, that he will regain full mobility. Is that is what is mentioned in the audio? No, right? In the audio, they are telling she is doubtful. His mobility is in question, right? So that is an extreme contradiction. So that is what we call as an extreme contradiction, right? It is extreme. It is exactly the opposite of what is mentioned in the audio. So what will you do? You will eliminate answer option B, right? So the very first answer option that you will eliminate is answer option B, right? So now you're left with two answer options. Now it is either answer option A or it is going to be answer option B. And answer option B, C, this is mentioned, but this is not yet mentioned, right? So it is either A or it is either C. Right. So now you have to again patiently wait. You still haven't found the answer. You have to patiently wait whether whether she is concerned or whether his attitude and she was unable to identify. So let's wait whether they're going to be talking about that. Right. So here she's saying, so was his style. So his style was also in question. Doctors had told him that he might never be able to squeeze into his motorbike leathers again. Leathers basically means the jackets. Okay, so this is leather jackets, right? So he's a professional rider. Okay, so there are some people who are really crazy about motorbikes and all, right? Thank God I'm not that kind of a person. But some people are like really crazy about it, right? So they purchase a bike and they purchase all kind of jackets. Okay, so that is jackets and gears. Okay, that is right? The professional riders and all, they wear those kind of things. So that is the meaning of motorbike leathers. You must be able to, this is a phrase, okay, this is a colloquial phrase, it is an advanced phrase over there. You should be able to sense, okay, this is what the meaning. So here, what is the doctor saying? The doctor is saying that he might never be able to squeeze into his motorbike leathers. That is, he is never going to wear his jackets and gears because his condition is very bad. He has a lot of broken ribs. He has fractures in his legs and arms, that he is never going to wear jackets and gears. Okay, that is what the doctors are saying. Right. So obviously, when someone is really crazy about motorbikes, when someone's dream is to keep on driving, when the doctor is going to say all these things, how are they going to feel? The person is going to feel extremely emotionally broken, right? See, that is, you have to make the connection like this. So this is the reason why he is emotionally broken, right? So he had given up. Now see, he had given up. So when will we give up in life? We give up in life when we are hopeless. Okay, when we see no hope, when we have no clarity, that is when we give up in life. So once again, what is the emphasis coming? The emphasis is coming once again to answer option C. See, emotionally broken. He's never going to wear his motorbike jackets, right? And he has given up. He has completely given up on his entire life's dream, right? So you're coming back to answer option C. You have eliminated B option. We're coming to answer option C. Now again, mainly concerned. So let's see whether the person is concerned or not. Now she is saying, imagine. Okay, now she's telling to the doctors, imagine how he must have felt. So see, what is she doing? She is empathizing, right? So what is the meaning of empathy? Empathy basically means being able to, see life from another person's angle. Right. So now she is empathizing with him. She is saying, imagine how he must have felt when the doctors told him that he is never going to ride his bike again. Imagine how emotionally broken he must have felt. That is one day totally independent. That is one moment he is completely independent, and the next day he is unable to do anything more. So that is now from being completely independent after one accident, now he is completely bedridden. So what is she doing? She is empathizing with the patient because she is concerned. Okay, she is concerned about his state of, that is, he had given up. He is emotionally broken. He is never going to drive his motorbike again, and he is completely dependent on other people. So regarding his state of mind, she is extremely concerned, and she is expressing that concern over here. Right. So you should be able to make the connection. Okay, and you should be able to choose answer option C as the right answer. So B we have already eliminated. So I have already given you why B is reason why B is eliminated, because it is an extreme contradiction. Now we have one more answer option, right? That is answer option A. What is answer option A? Unable to identify with his attitude. So his attitude is mentioned, right? So what is his attitude? His attitude is he is emotionally broken. Okay, he is very depressed. He is hopeless. He has given up on his life. But what is the action over here? The action over here is she is unable to identify. So that is once again a contradiction. Is she not empathizing with the patient? Is she not able to understand that? No. Is she not able to understand the attitude of the patient? No, right? She is definitely able to understand the feelings and emotions of the patient. She is definitely able to identify with the attitude of the patient. So this verb is completely wrong, right? And here also, he would regain full mobility. So see the verbs over here. Okay, regaining full mobility, the exact opposite. This is mobility is in question. Okay, mobility is doubtful. So answer option B is eliminated. Unable to identify, that is also wrong. Why? Because she is able to understand what he is feeling. So if you eliminate A and B, which answer option is left? Answer option C is left, right? So you can choose answer option C as the right answer. Right? So now let's take a look into the audio once again. Just give me a second. Sometimes my network may suddenly go because it's 10:30 p.m. So the network people. So if it goes, I'll be coming back. All right. So let's just very quickly listen to the audio once again. Emotional well-being. Now let's listen to the audio script.
Now onto my case study. It involves a patient called Ted, a 60-year-old man whose motorbike was in collision with a car. Luckily, the accident happened at moderate speed, but he still suffered compound fractures in both legs, in one arm, and several broken ribs. When I first met him, after 2 weeks in hospital, he was physically and emotionally broken. After all, not only was his mobility in question, but much more importantly, so was his style. Doctors had told him that he might never be able to squeeze into his motorbike leathers again. So he'd given up. Imagine how he must have felt. One day, totally independent, and the next, suddenly unable to do things anymore.
Right? So that makes more clarity, right? Just give me a small second over there. Okay. All right. So I have switched to my smartphone connection. I hope it is clear. All right. Because suddenly the network may go. All right. So now I have prepared one document over here as well. So let's just take a document with the 38th question. So what type of question is this? Okay, so this is not a main focus idea or a main idea type question. This is understanding the attitude of the speaker. Okay, your duty over here is when she first met the patient, what was the attitude that she demonstrated? So this is an attitude type question. So it asks you to identify what the speaker was mainly thinking or feeling at a particular moment. Okay, that is the moment is when first Anna met Ted. Such questions are very common part C, and they test your ability to interpret the speaker's perspective, feelings, and priorities. Right. So these type of questions are when Anna first met the patient. Okay. So this is the initial, concern or reaction that you need to find out. Okay, so certain tips over here. Okay, look for words in the question such as attitude, feelings, okay, concern, okay, all these kind of things will usually indicate, okay, this is the, attitude type questions. Okay, so in the questions, in the answer option, sometimes the mental focus, physics, again, every question is different, but you can expect these type of answer options, this thing. Right, so now how do you mentally prepare for such type of questions? Shift your mindset to empathy, right? See, that is what I told you. Once you identify the question type, then you have to apply in certain strategies. So here you have to identify the attitude of the speaker. So that means you have to think from the perspective of the speaker. You have to not think from the listener's perspective, but from the speaker's perspective. So shift your mindset to empathy. What was the speaker's emotional or mental focus there? Listen for emotional words, that is emotive words. See, given up, okay, broken, physically and emotionally broken, okay, and then you should be able to ignore the small distraction that is happening. Spotting contract again, you can just go through this document towards the end. That will definitely help you out, and you should be able to eliminate the wrong answer options. That is, see, it is not, I'm going to be very honest with you, it is not always going to be very easy to directly choose the correct answer option, right? But eliminating the incorrect answer options is a little bit easier. So that elimination strategy, you have to perfect it. Even if you struggle with choosing the correct answer option, you should not struggle with eliminating the incorrect answer options, right? That is something that you really need to perfect it. So answer option A, unable to identify. So we cannot choose that because she was able to identify, right? She's empathizing, right? She's empathizing. Imagine how he must have felt. And answer option B, she was optimistic that he will regain full mobility, right? So the doctor is saying that he might not ride again. Okay, because he is physically and emotionally broken. So no optimism. Again, mobility is in question. So no optimism is shown over there. So answer option A and B is eliminated. So if A and B is eliminated, then what by default, answer option C becomes the right answer. Right. And here also there's a list of vocabulary over here. So we can go through this vocabulary list. That will definitely help you out, right? So listen for emotional language. So these type of questions, you must give more importance to emotive words. Again, part C is speaker based, right? So the speaker is sharing their emotions. Attitude type questions will reflect you to focus on these type of languages, right? So this is where you have to give more focus on. And again, empathetic interpretation. So you have to interpret the message with a little bit of empathy over here. Okay, putting yourself in the shoes of another person. Right. So again, the emotional emphasis again. So again, I'll be sending this document to you later on. You can take a look into that once the session is done. Right. So let's have a small recap of what we just discussed. So in today's discussion, what happened to this? Okay. So in today's class, what did we discuss? So we discussed these two types of questions, right? We discussed main focus type questions. We discussed attitude type questions. And I specifically mentioned how to bring in the pre-effective listening skill. That is, even before the listening begins, the skill begins. That is your skill start. That is the 90 seconds, how you're supposed to strategically spend it. Right. So that is extremely important. Only then you will be able to identify what your duty is. Okay, what type of questions you're basically dealing with. So why understanding such types of questions is important. Again, when it comes to main focus type questions, one central idea. One central idea is what you to listen and identify. So there will be a lot of repetition. Okay, the central idea will be repeated, a lot of emphasis, a lot of stress will be given to one particular information, and you should be able to ignore the background information. Right. And then when it comes to attitude or concern type questions, you have to, think from the speaker's perspective. So give more importance to emotive words that expresses emotions and feelings, concerns and all of the speaker. There's certain words that you can use over here, and strategies are these particular strategies over here. Right. So that is what we discussed in today's session.